Assalamualaikum viewers and welcome back to our channel. Today in the playlist of oral and maxillofacial surgery, we are back with another topic in the odontogenic infection, that is the submandibular space infection. So basically in the every infection that is being involving any of the spaces, we first need to know about the boundaries, then we need to know about the contents that are being involved in that space, then we need to know about the source from where the infection has basically originated and it has involved that particular space. And after that we will study about the clinical feature and the management. As far the management of these space infections are concerned, we will have a separate video on that will be basically involving all the principles that will guide us in the management of odontogenic infection. So we will have a separate video for that, and for the management of all these facial spaces infection, you can refer to that video. So further proceeding on with the submandibular space infection, we will study about the boundaries. So as we can see in the diagram as well, first of all, medially the space is being bounded by the mylohyoid hyoglossus. Both of the mylohyoid or the hyoglossus muscle, it will medially bound the submandibular space. Then the lateral boundary involves the platysma muscle or the skin. Anteriorly, it is bounded by the anterior belly of digastric, and posteriorly, it is bounded by the posterior belly of digastric muscle. Superiorly, we will have the junction of the medial aspect of the mandible and mylohyoid, and inferiorly, we will have the bellies of digastric and hyoid bone. So as the boundaries are done, now we will move on towards the contents. Contents usually include superficial lobe of submandibular gland, it is present in the submandibular space. Then we will have the submandibular lymph nodes, we will have the facial artery and veins, and the marginal mandibular branch of the mandibular nerve. So all these were the contents that are being present in the submandibular space. Source of infection, it is usually the odontogenic infection that will arise in the mandibular second and the third molars, or any secondary it can also involve secondarily from any the space infections that are present, any spaces that are nearby the submandibular space and they get infected, so the infection can also spread from these spaces into the submandibular space. Spread of infection, first same side sublingual, then opposite side submandibular gland, and then from the sublingual submandibular gland the opposite side sublingual also get infected. So this kind of pathway, it is also being discussed in the Ludwig's angina as well, so you can refer on to that video to understand it more deeply about the spread of infectious route. As we know that submandibular and the sublingual spaces, they are being separated by the mylohyoid muscle attachment. So if any of my submandibular space on any side it get involved, the infection can directly spread from the submandibular space through the posterior attachment of the mylohyoid into the sublingual of the same side. Then as the sublingual get involved, sublingual spaces, both side sublingual spaces that were connected by the loose areolar connective tissue. So infection can easily spread from one side of sublingual space to the other side of sublingual space through this loose areolar connective tissue. So now as the opposite side sublingual space also get infected, again the infection will spread from the sublingual of the opposite side through the attachment of the mylohyoid into the submandibular of the opposite side as well. So this is a common pathway and spread of infectious route. So in the more advanced cases, it could also involve the para or retropharyngeal spaces, and eventually this all will lead to the appearance or manifestation of Ludwig's angina. Again, the Ludwig's angina, we have made a separate video on that topic, so you can refer to that video as well for having in-depth understanding of the submandibular, sublingual and submental spaces in all the bilateral swelling involving all these three facial spaces. So that was basically manifested as a Ludwig's angina. Now moving on towards the clinical feature of submandibular space infection, we will have a triangular swelling in the submandibular region, or we could have the submandibular lymphadenopathy, fever, dehydration, toxic appearance, and in advanced cases where it will be manifested as the root veins angina. So we will have the toxic appearance in this fever, dehydration, septicemia, airway obstruction, brownie edema. So these were all the features and manifestation of root veins angina. That was a complication that involving all the three submandibular, sublingual, and submental spaces. So this was all about the submandibular space infection. I hope this video will be helpful for you all. Don't forget to subscribe to our channel for more videos and updates. Thank you.